Yeah, the last few days have been, well, it's been quite energetic, but also great learning. We recognize that this is going down and helping screen multiple thousands. BD has a goal of 75,000 women for cervical cancer, but it's more than that with this trip. We're really building a system that when BD's there or not there, that this clinic is going to be able to grow, thrive, and be self-sustainable.
So as a trusted partner of BD for the last 20 years, Direct Relief is just really honored to have been chosen by BD to come and implement this program in Peru to help women with cervical cancer. We're working very closely with the CerviCusco Clinic, with its founder, Dr. Darren Ferris, Dr. Sammy Venero, which is their medical director, and then there are other staff members of nurses and campaign directors and management of the staff to really develop an incredible opportunity for the BD volunteers to come and be able to lend their expertise in 5 different areas for the clinic. First, to make it sustainable in a business standpoint where it can bring in additional revenue and really be able to be self-sufficient going forward through corporate partnerships and other types of increase in services. A team that's the IT team that's really developing the one of the first electronic medical records systems for a clinic that treats the poor in the developing world. We have also a team of a lean laboratory, Six Sigma, and the experts there are going to be developing the new CerviCusco laboratory that we're going to be building. And then we also have a group of primary healthcare providers that are working hand in hand with the CerviCusco medical team to be able to help them as they go out on campaigns anywhere from 1 to 4 hours outside of Cusco and testing anywhere from 100 to 300 women in one day. And these are very under-resourced women, kind of the poorest of the poor that live up in the mountains of Peru. And then we also have a team of communications and multimedia and website that are building a new website for CerviCusco and helping CerviCusco in its messaging so that it's able to reach out to the public and reach out to businesses so that it can better tell its story and the great impact that it's making here in the Cusco region.
This week we've been here in Cusco at the CerviCusco Clinic as part of the volunteer service trip. And so I've had the opportunity to watch firsthand as the volunteers roll their sleeves up and start their work. And I think that the volunteer service trip opportunities that BD offers to our employees is really a fantastic way for them to really connect to the mission of helping all people live healthy lives. And if there's any setting in which that can be seen, it's here in Cusco, where there's such a high rate of cervical cancer and where the clinic is doing such good outreach and work to prevent cervical cancer among the indigenous population of Cusco.
So the great thing about the outreach and the clinic is when the women are informed that they do have a positive Pap test, they do come back to the clinic for follow-up. And we did have one woman come back and she did have a positive Pap. It was a CIN3, which is a moderate to severe dysplasia.
Yes.
And she had to have a colposcopy and she ended up having a LEEP or surgery to remove the lesion. And ultimately, they saved her life here this week. She was so grateful. She just hugged and kissed everybody in the room. It was pretty amazing to see how much she appreciated the follow-up and the fact that they saved her life here.